Okay, now let's discuss the pediatric examination. Discussion should always be age appropriate, okay, for the child. Make sure that they understand what is going on. We can use simple words in this case, like tummies and boo-boos. One of your biggest goals is to help to explain the procedure to relieve fear, and some of the ways that you can do this is to allow the child to look at the instruments, perhaps do a procedure on yourself, have the parent get involved, and if you're going to be looking in their ears and they're terrified of that, perhaps have them look in your ears, have them look in a parent's ears, so they realize that the procedure is simple and usually quite painless. Again, always speak in age-appropriate terms, and we should really never lie to the children. If they do ask if something is going to hurt, well, you don't have to over-exaggerate that. To lie to them would then make them mistrust you in the future exam. There are a number of well-child visits, so they need 7 total visits during their first year. And this is the basic schedule, so 2 weeks, 1 month, 2 months, 4 months, 6 months, 9 months, and at the 1-year mark. For our purposes in this class, just be aware that they need 7 total visits during that first year, so it can be quite a bit for mom, with a new baby. In the second year, we see a visit at 15 months and at 18 months. And then the third year, we see one at 24 and 30. And then every year after that, it is just annually after 3 years old, so it is just 1 time per year for a well-child exam. You should prepare the exam the same as you would for an adult. We do have smaller tools, so smaller blood pressure cuffs, smaller thermometers, so do use the appropriate size tool, but it is the same set of tools for vital signs. And always follow our standard precautions, so hopefully by now you realize that means, okay, wear gloves if you feel like you need a gown, a mask, or anything else as we have talked about in the past. That is followed still with children as it is with adults. So here's a question for you. Chris is 2 years old and is due for his well-child exam. When you try to take his temperature, he starts to cry and hide behind his mother. Okay, what were some of the things we talked about that you can do to gain his cooperation? All right, hopefully you answered some of the stuff we talked about. You could let them examine the thermometer, explain the procedure, try taking the mother's temperature. Also, they realize that this is a normal procedure that is not painful. Next, let's talk a little bit about immunizations. And this is one of the homework questions that I've given to you, is to look at the U.S. schedule of immunizations. Immunizations do protect against infectious disease. What this does essentially is that it introduces the object into your body, and then your body does create cells in order to fight it off. And this should provide lifelong infection control. So vaccinations do come in different forms. They can be a weakened strain of a virus, meaning it's not completely dead, but it's weak, and it's usually too weak to cause an illness. You can have a totally killed virus, and in this case, if it still makes your body produce those cells, it is best to totally kill it. And we have something we call a toxoid, which is just a weakened toxin or a weakened version of bacteria, okay, which prevent against bacterial infections that may be spread. As far as your role as the medical assistant in the immunization process, you can certainly schedule appointments. Make sure that parents are aware of the schedule on which immunizations are coming up. You can do education for parents. This would include making sure that you gain an informed consent form. The CDC website, if you go to the CDC and look up information on any one of the immunizations, will have a handout form that you can simply print right from their website and give to parents. In New York State, you cannot administer the vaccine. However, in a number of states, you are allowed to do so. So it depends on if you plan on staying in New York or if you plan on moving. You can certainly document that immunizations were given. And of course, you should ensure that proper vaccine storage has occurred. Most of these storage requirements are written on the bottles or the packages. Oftentimes, they have to be kept in a refrigerator, to keep them from breaking down. And they generally have an expiration date, so we would not want to give an immunization to a child that has been expired, or has not been stored properly, because it may not be as effective as it should be. Again, one of your homework questions is to look at the schedule, and it is in your packet of notes, at least the U.S. schedule, so we will be discussing this component in class. One of the things you have to make sure that is done if a child is getting a vaccine at the office visit that day is to get a signed, informed consent form. Again, you can find these simply from the CDC website, and they are available to print and to give to your patients as long as you do not financially gain from this. You should explain the benefits and the risks, and you should have the parents sign that they understand the benefits versus the risks of receiving a vaccine. Vaccines do come in a couple different forms. The most common, of course, is through a needle with injection. They do have oral ones, however. They are not as commonly used, so they would be done through the mouth. And they now have a flu nasal vaccine where the child can simply inhale the immunization right through the nose, so you do not have to get an injection. We had previously talked about contraindications to getting a vaccine, and some of these included having a high fever, being allergic to any of the components, or having had a previous reaction to a vaccine. So do check for some of the more common contraindications as part of your history taking before somebody comes in to administer the vaccine. Records need to be kept up to date. There has to be specific information. We'll talk about that. And parents should also maintain a record of all of their child's immunizations. Again, every vaccine is slightly different, so do read the instructions, but generally it has to be kept at the correct temperature, usually in a refrigerator. You should rotate your stock, so make sure that you don't have things that are expired, pushed towards the back of your refrigerator or your cabinet, but you should be using things that expire first before things that do not. In pharmacology course, you will learn about how we prepare for administration, and when we talk about infection control guidelines, again, in New York State, you do not physically give the immunization. So again, you had a number of responsibilities, which included all of the following. All right, let's talk a little bit about some screening. This one, along with the video you watched about taking vital signs, so you have seen some of this before. So we do compare to national averages, and that is where we get our percentile number from. And as a medical assistant, you will take vital signs, measurements. You can do vision and hearing tests. You can collect specimens, which is part of the 230 medical laboratory class. And in New York State, you cannot administer medications or immunizations, but in some states, you are able to do so. Vital signs are essentially the same as when we did them with adults. However, we always take our temperature last. It's just because with the crying and some of the other difficulties, this is the easy one to do as our last vital component. And for a child that is less than 5, we should not do an oral temperature, and that is often because the child cannot keep the thermometer securely placed in the mouth, and the temperature may not be accurate. Blood pressure, again, they do make child-size cuffs. We do not do that longer method that we had discussed, and we do not have to inflate it quite so high, so keep the inflation on this one, to a slightly lower end because we don't want to hurt our children with a blood pressure cuff. And so you do want to listen, okay, for a blood pressure if necessary, okay, on these patients. Unlike an adult, okay, where we might just do certain visits, weight, okay, is done at each visit. We do want to make sure that the child is growing at a proper and a proper amount. Length, okay, is the term we use for infants as opposed to height, which is what we call it in adults. Head circumference, and there is a video on head circumference, and chest circumference, which is essentially the same procedure as a head circumference, but simply taken around the chest. For the eye and ear exam, okay, it is pretty much the same thing as the adult eye and ear exam. The pediatrician may do the internal examination of the eyes. You guys can certainly do the visual acuity testing, but in this case, instead of using the letter chart, as we talked about, you would use the chart of symbols, okay, or the E's, or the C's, or the U's, or whatever other chart is available to you. For the ear exam, again, you test the child the same way as an adult. And for somebody who's quite young, what you want to do is simply check for a response to sound. So you would stand behind a patient and do realize that their hearing is generally more sensitive than an adult. Okay, and you would snap your fingers, clap your hands, have a parent call their name softly to see if the infant or the toddler turns their head and responds, okay, to the adult. For some diagnostic testing, what is very common in young children is a rapid strep test, which stands for streptococcal bacteria. This would tell us if we need to give antibiotics or not. This test is one that you will complete and perform inside the medical laboratory class next semester. You may do urine specimens, okay, and blood draws. Okay. All of these diagnostic tests are done in their own medical laboratory class.